I'm Macy, and I'm going to be talking about Toxocariasis, the parasitic disease, and how the smallest little creature can cause so much chaos. So starting off, toxocariasis is the clinical term applied to infection in the human host with either Toxocara canis, which is transmitted from dogs, or Toxocara cati, which comes from cats. Canis was founded in 1782 by Werner, and cati founded in 1788 by Schrank. Initially, Werner named it Lumbricus canis. It wasn't until a few years later it was identified as a member of the genus Toxocara, which was established by Stiles in 1905. So there was quite a few years in between those times. And then in 1788, Schrank first documented and named the roundworm parasite found in cats. It wasn't until 1927 that Brump's work refined the classification of the parasite, confirming its scientific name as Toxocara cati. And then now I will explain the causative agent. So it is the larva of the roundworm parasites, Toxocara canis, dog roundworm, and then Toxocara cati, cat roundworm. And now I'm going to explain a little bit more about the roundworm itself. So it all starts with the larva. This one, as you can see, has a cylindrical kind of round shape, hence the name roundworm. It has bilateral symmetry, so their bodies have a definite head and tail with a distinct front and back. They possess a body cavity or pseudocylin, which contains internal organs. They have a tough outer covering secreted by epidermal cells, which protects their bodies. It has a hydrostatic skeleton, so fluid within the pseudocylin provides all support and then helps movement. And then what I found that was really interesting was that they have a complete digestive system. So they have a mouth, intestine, and anus for digestion. And then the size does vary in length. So it can start to be less than 1 millimeter and then grow to be over 7 meters. So the range is pretty wide. And then these larvae migrate through the human body, and it can cause inflammation and potential damage to organs like the eyes and nerves. But they don't develop into humans. They're not capable of reproduction for us. In their natural host, dogs and cats, the larvae have a molecular signpost to guide them to the digestive tract where they're able to mature and reproduce in there. Due to us being humans, these signposts are not recognized, which often lead the larva to a different route, oftentimes causing death. So whenever these larvae make their way into the digestive tract of the animals, the female can lay up to 200,000 eggs a day. So this is why it's very important that if you adopt animals from shelters or things like that, to always get them checked out for things like this. And so now we'll talk about hallmarks of this disease and how something so serious can happen. So there's 4 main types. There's visceral larva migrans, so VLM, ocular larva migrans, OLM, covert, which is also known as common toxocariasis, and then neurotoxocariasis. So starting off with VLM, this form is very similar to covert toxocariasis. It typically occurs in preschool-aged children with a history of eating dirt. OLM is when the migration of the roundworm larva makes its way into the eye. So as you can see here in this picture, this is what it would look like if you were to have the roundworm in your eye and you're looking out. You just kind of have that line, those lines, because the worm is going across your retina. And then in covert, this is a mild case or form of toxocariasis. So this one's characterized by the presence of toxocara antibodies in the blood, along with a range of non-specific symptoms, which is why this one is one of the less severe ones. And then lastly is neurotoxocariasis. So this is a neurological disorder caused by the migration of parasitic roundworms into the central nervous system. So this is what I think is the most severe. This one can cause a lot of damage. And so now I will go into the manifestations of each of the hallmarks. So for VLM, we have fever, fatigue, abdominal pain, a cough, wheezing, enlarged liver, and then elevated IgE levels. It's okay to have a little bit raised IgE levels. It shows that you have antibodies to a parasite. But whenever your levels are elevated to an extreme or pretty high, it shows that you have a parasite now and that your body is trying to fight it off, but it can't always do that. And now for OLM, since this affects the eyes, these are all going to be vision related. So vision loss, blurred vision, having issues with your retina. You can become cross-eyed, and then most cases it's just eye pain or redness. And then for covert toxocariasis, so this one is also, as I said, pretty similar to visceral, but it's less severe in the sense that sometimes humans won't even get symptoms. Sometimes this one's just able to run its course on its own. So some manifestations, if any, are present. Could be intermittent abdominal pain, headaches, sleep disturbances, coughing or wheezing, and then sometimes some behavioral changes. And then lastly, there's a reason why I think neurotoxocariasis is one of the most severe kinds. It can cause meningitis through a process called neural larva migrans. The roundworm larvae migrate from the gastrointestinal tract to the brain, where they cause inflammation and tissue damage, leading to eosinophilic meningitis. This inflammation is characterized by an elevated number of white blood cells in the cerebral spinal fluid. So things like this, it can cause inflammation to the brain, seizures, and neuropsychiatric symptoms. So behavioral symptoms like mood changes, emotion, and behavior. So this is why it's very important to take care of yourself, your animals. It's not super fatal, but there have been some severe cases where people will already be sick with an underlying condition and then get toxocariasis on top of it and end up passing. And then now I will talk more about the carriers and the transmission route. So it's primarily transmitted through accidental ingestion of the roundworm eggs, which are shed in the feces of cats and dogs, making them the main carriers of this. The transmission route is fecal oral, which is gross, but that means when the pathogen from fecal matters of one person or animal are transferred to the mouth of another. And then going along with that, so for treatment, most cases of covert toxocariasis end up resolving on their own within a few months because the larva cannot complete its full cycle like it can in animals. So humans are not the original host. That is why. Most of the time, people don't even get symptoms. But for the cases that are more severe, albendazole is really one of the only main options for this. It's used to treat infections caused by worms. It keeps the worms from absorbing glucose, so the worm can lose energy and die. For OLM, the best treatment is anti-inflammatory medication. So antihistamines, albendazole. For VLM, albendazole is required if not self-limiting, and antihistamines can also be used to manage inflammation. The same could be used for neurotoxocariasis. In rare cases, surgery might be considered for that because it does have to do with the brain. Right now, there is still no vaccine, not even for animals, which I will cover later on. And then now going into the long-term effects. So for OLM, we have vision loss, retinal detachment, retinal fibrosis. For VLM, we have organ damage, myocarditis, which can affect the heart, pulmonary fibrosis, enlarged liver and spleen. And then for neurotoxocariasis, we have meningitis, encephalitis, neurological damage, and epilepsy. So some pretty severe things if this is not taken care of properly. And then there are no widespread epidemics, but localized clusters have occurred in daycares, schools, and shelters with high animal contact. Recent studies have identified persistent racial and socioeconomic disparities, infection rates in the U.S. So emerging evidence also links chronic toxocara infection to cognitive delays and asthma development in children. It's most prevalent in warmer climates. Heat can facilitate the spread of toxocariasis, particularly ocular toxocariasis, which is pretty interesting. The toxocara eggs develop and become more infectious at temperatures above 50 degrees Fahrenheit. So when it's cold, this one's not as prevalent because it does live in the soil, basically. In warmer environments, the eggs can survive longer in contaminated soil, increasing the risk of transmission because, dogs are always roaming around and things like that. It's also more prevalent in developing countries, as you can see in these maps. It's due to the factors like higher prevalence of dogs and cats spaying on the streets and things like that, poor sanitation, and, as I said, warmer climates. These factors contribute to the contamination of soil and consequently higher exposure rates to infective eggs in vulnerable populations, especially children that play around in these dirty areas. So doctors are researching more into the development of early onset asthma due to the high exposure of toxocariasis at a young age. This is very important discovery because this disease triggers an inflammatory response in the lungs, similar to having allergen-induced asthma. The parasitic infection can lead to increased mucus production in the airways and eosinophilia, all which are also features of asthma. So while the National Institute of Health may not have specifically named Toxocar grants and funding for this, there are funding through various channels, including the Committee of Interns and Residents Patient Care Trust Fund. The U.S. Department of Health and Human Services is also looking into this because it does affect a pretty big range worldwide. And organizations like the Texas Children's Hospital Center for Vaccine Development. So this is something that's pretty important that they're starting to finally realize that we could put a stop to this with a vaccine. And then something that I wanted to share was the animals infected, because dogs and cats are the main reservoirs of this. So dogs primarily get roundworm by ingesting the parasites' eggs from either their environment or from eating infected animals such as rodents or other prey. A roundworm egg can be present in contaminated soil, feces, and even on the fur of infected animals, which is pretty interesting. Puppies can also acquire roundworms from their mother either before birth, through the placenta, or during nursing. So this can also cause vomiting, seizures, weight loss, and fatigue in animals. So just kind of imagine what it could do to the human body. That is all I have for y'all, and I cannot wait to answer any questions in class.